without further ado, I'm going to get started. This is my friend, Nara Reed. She is awesome. I love her. I thank you again for doing this with me and sharing your wonderful information and energy and spirit. I really appreciate that.
But thank you for
awesome.
having me. From, north and coming south and not knowing anyone. And from day one, it was like family. So I appreciate you for having me today.
So this channel is a resource for pregnancy and health. And so she is phenomenal in that Nara tells people and helps people change their lives in small ways that make huge impacts in overall health. And so with that, this first series is all about helping people when they're first pregnant and they, just want to know what they should be doing.
My name is Nara, like Ty said. I am a dietitian nutritionist and I am a certified health coach. And I have a virtual platform called Modified Nutrition Health Coach. And exactly what she said, I help people make small changes that have lasting results. And so pregnancy is very dear to me. I've only have 3 babies, but in my day-to-day profession, I work with moms from pregnancy to postpartum during my health coaching practice. I always say I got some babies out there only because I work with moms that want to get their bodies under, healthy. They want to start the process of pregnancy. So I've definitely went through journeys of pre-preg, pregnancy, and after pregnancy. So again, this is definitely a passion of mine. A lot of things that women go through, I may or may not have professionally or personally have gone through it. So this is definitely, a great topic. And again, thank you for having me. So when it comes to pregnancy, one of the things that I always have moms to kind of think about, if we can help it before pregnancy or when you're in a thought process of it, especially if it's a planned pregnancy, to try your best to get the body, in the most healthiest state as you can. That's just developing routines, because we're going to have a routine before baby, after baby. So definitely getting the body into really good healthy regimens. I did this myself with my younger one. I gave myself 9 months to prepare my body, my mind, after 14 years of having a baby, to truly just mind, body, and soul. There was a whole mind, body, and soul connection when it came to getting the body ready for pregnancy, to have a successful pregnancy. So that's one of my first tips, is if you can possibly help it, create a regimen, look at your lifestyle. If from the moment you wake up to the moment you go to bed, you're exhausted, you're frustrated, you're stressed, let's develop some really great routines to incorporate you in the mix of that. I always tell moms, we always find ways to put ourselves in the things that we enjoy at the end of our list. But if we just learn how to embed ourselves within that, just the way we brush our teeth, we want to take our vitamins, we want to drink our water, we want to start looking at our diet, we want to make sure we're having those fruits and vegetables. So again, the first tip is, if you can control, let's start pre-pregnancy thinking of getting the body in a healthier state.
That is really important too, because that also helps to prevent so many of the problems in pregnancy that can cause bad outcomes. So if you can do it before you're pregnant, that's great.
Yes.
Because, that's what we're all about here at Baby Me Well, is preparing you, mind, body, and spirit, to be a parent, right? To guide this other little being through life.
Yes.
And it would be ideal if we could all do it beforehand.
I got 2 of them. I was not.
So if you have not prepared, what can you do?
Definitely at the moment, I think old school, people say, if it's pink, it's not true, or something to that aspect. You don't have to make any changes until you see the pink. So once you see the pink, once you see those double lines or that happy face, or, whatever that is, once the pregnancy is definitely confirmed, or you kind of figure that maybe you are pregnant, this is when you start. So if you couldn't do it prior to pregnancy, definitely at that moment, start going through the steps, to get the pregnancy confirmed for sure, and just completely start going through the steps of peeling the layers back. Make sure you're hydrated. First trimester is very important when it comes to rest. Don't overthink it. I know pregnancy can have, there's full of emotions when we come to knowing that we're going to be a mommy and we're expanding our family. So at that moment, dig deep, become very present. I always say connect with your wound. I don't care if you're 3 weeks pregnant or 33 weeks pregnant. Communicate to that baby, put that hand in that wound and say, we're going to be okay. Try to release the stress, embrace the happiness of it, but definitely, focus down on the foods, the prenatal vitamins, and make that first doctor's appointment for sure, or midwifery appointment.
What exact care provider you are going to seek out, the earlier, the better. The earlier, the better. If you have insurance, great. If you don't, you still can go and get prenatal care established, because that's so important for you to have a healthy pregnancy and a healthy childbirth and a healthy baby.
Join us next week as we continue our discussion on starting your pregnancy strong with Nara Reed, Dietitian and Health Coach. Thank you so much for watching.